When you hear birth plan, what comes to your mind? Birth plan is not talking about the pampers, it's not talking about the wipes, it's not talking about your baby carrier, neither is it talking about your pram. It is talking about something different entirely, which we are going to be discussing on this particular video. Good day everyone and welcome back to Nurses Lecture Room. My name is Mercy Mary and today we are going to be talking about birth plan, and I'm going to be sharing with you my personal birth plan, and from my birth plan and also the whole idea of birth plan, you should be able to draft out your own birth plan. So the first question is, what is a birth plan? A birth plan is a record of those activities that are going to take place during labor, at birth, and after the birth of your beautiful baby. When it comes to a birth plan, you might decide not to create one, but if you wish to have a birth plan, it is very important you discuss that with your midwife. When you discuss your birth plan with your midwife, it gives your midwife this idea, this knowledge about you. Your midwife tends to explain the risks of each aspect of labor. It tends to explain the benefits of anything you're going to be doing, the dangers, the advantages, the advantage. It just gives you a better insight of what a labor is. And for a birth plan, I would advise a birth plan for all first-time mom. And when it comes to a birth plan, you don't have to be rigid when it comes to the birth plan, like this is what I want on my birth plan, this is it and that is it. You have to be flexible a bit because things can actually change when it comes to giving birth to your baby. So you be flexible a bit, but first of all, just draft out the birth plan, what you aim to achieve, but at least be flexible and don't be rigid with your birth plan. So I'm going to be taking you. The first thing that's going to be in your birth plan is, where do you hope to give birth? Yes, where do you want to give birth? Do you want to give birth at home? Do you want to give birth in the pool? Do you want to give birth in among the midwives? Do you want to give birth among the maternity team in the hospital? Do you want to give birth in the delivery suite? So you're going to be provided with different options and you're going to pick one. Like I earlier said, it's personalized. It's just you. They're talking about you. But I think while this preference, while they're asking you to pick, they're going to take into consideration your medical history, your past surgical history, and also if there are any underlying things that will make them like think about hospital as the best option or cesarean section as the best option. But the first question they are likely going to ask you is, where do you hope or where do you want to give birth? For me, I prefer the delivery suite and the hospital. Okay, I don't want to give birth at home. I don't want to give birth among the midwifery. I just prefer the delivery suites where you have the medical personnel just in case. It's just my preference. That was what I used for my first child, and that's what I used for my second child. Okay, before I go to the second point, I just want to let you know that when it comes to a birth plan, you have to be flexible. You don't have to be rigid. Yes, you have to be flexible. You have to okay, if this doesn't work, the hospital can do this. If this doesn't work, they should do this. You don't have to be rigid, like, this is what I want, this is what I want. I don't want to change it, all right? So you have to be flexible as much as you can. The goal is to make sure a healthy baby is born at the end of the day and the mother and the baby is fine. Then the second thing that is likely going to be in your birth plan is a companion, a birth companion. Do you want your husband? Do you want your sister? Do you want your mother? Do you want your daddy to be in the delivery suite with you? Who do you want to be with you while you are giving birth to your companion? So they're going to tell you different options. Then you can say, oh, I want my partner to be with me. I want my husband to be with me. I want my mom to be with me. I want my sister to be with me. So for me, I always prefer my husband to be with me during childbirth. For my first child, he was there from beginning to the ending. For my second child, he was also there from beginning to the ending. Like I earlier said, it's personal. It all depends on what you want. And also, under that companion, some people will when they want to use forceps, when they want to use the Ventouse method to bring out the baby, I don't want my partner to be there. I don't want my partner to be present. So you might decide, you want your companion during that procedure. You don't want your companion during that procedure. And also for companion too, during cesarean section, you might decide, my partner should be there. My partner cannot bear it. My mother cannot bear it. Let my sibling be around. Okay, so it all depends on who you want to be around you during each phase. Normal vaginal birth, who do you want to be around you? Cesarean section, do you want a companion or not? Then also, when they are using forceps, do you want a companion to be around or not? Like I earlier said, it's personal. It's what you want. But at least be flexible and not rigid. Another thing that is likely going to be in your birth plan is the activity during labor. There are some people, they want to move around during labor. They just want to be active. They just want to climb stairs. They just want to aggravate labor by themselves. Why some people like me, I don't want to move around. I just need all the painkillers. I need the gas and everything just to stay alive. Okay? So it all depends on what you want. You might decide during labor, I want to move around. I want to do more exercise to aid contractions and all that. So they're going to ask you, what activities do you want during labor? Another thing that's likely going to be entailed in your birth plan is the birthing equipment. There's some people that don't like, oh, they will need the birthing ball, they will need the mat. So what birthing equipment do you want? What birthing equipment you don't want? What do you want them to use for you? And also, what do you want them not to bring close to you? So that is why a birth plan is very important, because you give the midwife a first-hand knowledge of what you want and what you don't want. Another thing that is likely going to be entailed in your birth plan is, what position do you want to be in while giving birth? Do you want to be standing? Do you want to kneel down? Do you want to squat? What position do you think is better for you? They're going to ask you, okay? You're going to tell them your preference. But on that day of their delivery, on the day of birthing the baby, you might have a change of mind. You might have a change of plans. But the midwife is going to ask you, what position do you like? All right. Then the other thing that is likely going to be in your birth plan is the skin to skin contact with your baby. There are some people, they like the baby to come close to them before they clean with the cord in the placenta, everything, just bring the baby close to them. While there are some people, they want the baby to be cleaned first before you bring the baby for them to hold. Personally, I like the baby, like immediately the baby comes out of the vagina, the baby should be given to me directly. With the cord, with the death, everything, they should just give me my baby. So that's what I want. But some people, they prefer for the baby to be cleaned up, dressed up before being brought to them. So it's just like a personal preference. You let your midwife know what you prefer. So another thing that is likely going to be in your birth plan is, do you want doctors, nurses, midwives in training to be in the room? There are some people that have had bad experiences with student nurses, doctors, or midwives, and they don't really want to encounter that again. They'll tell you, no, I don't want nurses, doctors, or midwives in training to attend to me. I just want those that are qualified to attend to me. They're going to ask your permission. Even while you are in the labor room, they tell you, oh, this is a student midwife. Do you want them to take care of you or not? So you have to tell them what you prefer. So that is going to be included in your birth plan. Then another key point that is in your birth plan is the pain relief. What pain relief do you want? Do you want gas? Do you want epidural? What pain relief? They are going to be giving you different options when it comes to pain relief. And you are likely going to pick the one that is preferably, or the one that you prefer. And your midwife is going to record it. For me, I used gas and epidural. For the gas, it was knocking me out, and there is no way I get knocked out and I'll be able to push. So I asked for epidural. So in my next birth plan, when I'm going to give birth, I'll just tell them epidural straight. Because with epidural has its own pros and cons. That's one thing you should know. Your midwife is going to be discussing that with you. The gas has its own pros and cons. All painkillers have their own pros and cons. So they'll just discuss it with you and you tell them which one you are comfortable with. Though epidural has its own pros and cons, I kind of prefer epidural. I've been lucky with my 2 sets of epidural that I've had with the course of my childbirth. So painkillers is one of the key points when it comes to making a birth plan. So make sure your midwife discuss the pros and cons of each painkillers that is going to be administered to you during childbirth. Then another thing that is included in your birth plan is, do you want an episiotomy or you want to tear naturally? So there are some people that are like, oh, don't cut me. Let the baby cut me instead. I don't want a doctor to give me an episiotomy no matter how bad it gets. Why some people will tell you, oh, I want an episiotomy, you should be guided, and that is it. Okay, so when it comes to your birth plan, definitely your midwife is going to ask you, do you want an episiotomy or you want to have a tear? Then another key point that's going to be your birth plan is your baby. Do you want your baby to have vitamin K or not? So it's optional. They're not going to give your baby vitamin K without your permission. So you have to tell them, for me, I want my baby to have vitamin K. So definitely they're going to give my baby vitamin K. Definitely my 2 kids, they had their vitamin K immediately after birth. Another key point that you're likely going to find in your birth plan is the placenta. What do you want to do with the placenta? Yes. Do you want the midwife to discard the placenta? Do you want to take the placenta home? This is personal to you. So you have to let them know. So if you are the kind of person that takes your placenta home, let your midwife know. But if you are the person that just oh, you can discard the placenta, it's fine, just like me, you let them know too. All right. So that is that. Then another key point that is likely going to be in your birth plan is feeding. How do you want you to feed your baby immediately after birth? Do you want to breastfeed your baby, or you want your baby to have formula, or you are going to do formula and breast milk? So you have to let your midwife know your feeding method for your baby. So these are some of the things you are going to be finding in your birth plan. Then before I go, there is something I would like to tell you. These are for people that have traveled, they are not in their locality, they are not in their country, and they might need an interpreter. So you have to let your midwife know that, oh, I don't speak good English. I don't really understand. I speak, but I don't understand. I understand, but I don't speak. So they get an interpreter ready when you are in labor. So after all this discussion with your midwife take records of these things and hand it over to you, or probably save it in the system, depending on how they operate in that facility. So when it is time for labor, when you're having contraction, when you're having pain, you can hand them over. This is my birth plan, just in case I did not say anything. All right. So having a birth plan gives the midwife an idea of what you want, so they don't need to ask you consistently or constantly, oh, do you want this? Do you want this? What do you want? Do you want this? They already know, okay, this is what you want and this is your plan. All right. So having a birth plan is going to help you a lot. Though, even if you have a birth plan, the midwives are definitely going to ask you questions and are going to seek your permission before they give you any medications or before they do anything to you. They are going to ask for your consent despite having a birth plan. So like I earlier said, don't be rigid with your birth plan, but rather be flexible. Okay, thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.